So truth number two, of course, is that the medical system can and will use your partner's fear against you. So as long as they're convinced, as I said before, that something could go wrong, they'll keep trying to control, coerce, and even force compliance by enrolling your partner as the voice of reason. And this is exactly why I ended up having a hospital birth when I didn't want it, was because at one point there was a non-stress test I was doing. I realized that like there was nothing wrong with my baby. I'd been having all these tests that were just saying he's fine, he's growing, you're growing, baby's like there's nothing wrong. There's no reason why I couldn't have a home birth except for the fact that this had now been put in my chart. And because the midwives had to consult with the OB comes in and he's like, yeah, I understand that all these tests are right, but I still would say no to home birth because something might possibly maybe happen. And he looked directly at my partner. And there's like this dynamic, and you can see it where they will look at your partner because of the way that the context is, especially if it's a male doctor. They'll look at your partner and it'll be like, are you really going to let your wife risk your baby's life just so she can have a good experience? Like, no. And then they kind of shame without actually shaming. It's like, it would be really dangerous. You don't want to do this. And they're looking at your partner, or it doesn't even have to go that far. It's just like, you're in the tub. Like this happened to me. I'm in the tub. I don't want to move. They pull me out of the tub. They're dragging me to the bed. They want me on the bed, but the nurse and the midwife can't get me on the bed by themselves. And I'm resisting. My partner comes into the room at the time and he's like, well, where do you want her? And he just picks me up and he puts me on the bed because he's now seeing himself as helper of authority, not stand for my power. And I see this with a lot of clients. This is why I train them up, is because the partner needs to be that support. So your partner's role is not to follow the medical system, and they're not a glorified hand holder. What they are is a safe container for you to be as wild and do your thing, but they have to trust that you know what you're doing. So they're like, oh, she knows what she's doing. I'm following her lead. So when my clients, when their partners come to me and they're asking the questions, they're like, well, what do I do? I'm like, she's going to tell you what you need to do. I can't tell you what to do. This is the problem with a lot of birth classes is like, oh, if your partner's doing this, you do this. And there is a book called The Birth Partner. However, again, when you are the one on the outside trying to get somebody else to do something that you think needs to follow, this is why you need to trust your own instincts and throw out the textbooks. Because as they are helpful in some cases, is like getting an idea, recognize that your body is going to react a certain way. Recognize that maybe you don't want your partner talking to you during a contraction, or maybe you do want them to talk you through it. Maybe you do want them to touch you. And then at a certain point, you're like, I don't want to be touched anymore. Your partner can't just be like, oh, but it says in this book, I'm supposed to do this. So I'm going to do this, but it doesn't help. Or, oh, we need to get into this position because this is going on. It's like, no, that's not what my body tells me to do. So when you're in tune with yourself, they can't control it. And your partner needs to be there to tell the doctor basically to back off and to be like, thank you, but no.